It's officially 10 o'clock. So I'm calling the meeting of the Regional Advisory Council to order Thursday, March 26th, 2026. Let's go around the room and to establish the quorum. Is Laura Chronic here?
Oh, there's one. Clark Becker, Teller County.
B. Babbitt, Northern El Paso County.
Debbie Levinstein-Kevich, Colorado Springs.
And who do we have? Do we have one online? Okay. Scotty?
Sorry, Scotty Bibb, the Independent Center.
Perfect. Okay, that establishes our quorum. And the other introductions we have here in the room are.
Good morning, Jared Berner, Public Policy and Communications Manager at PPACG.
Carol McBroom, PPACG Finance Director.
And Melissa Martz, Program Administrator.
Thank you. Okay, we do have a change to the agenda. We are reversing 6A, I, and II. We're just reversing those two so that Nick will be first and Lori will be second. Do I have a motion to approve the agenda as modified?
I'll approve the agenda. Motions.
And a second?
I'll second. Clark.
Thank you. All in favor?
Aye.
Any opposed? Hearing none, the motion is approved for the agenda approval. Consent agenda. Do I hear a motion to approve the minutes? Because that's the only item in the consent. The minutes for January 26th meeting.
I'll approve.
Motion, please.
Motion to approve.
Second.
Second.
All in favor?
Aye.
Opposed? Hearing none, motion's approved. Consent agenda is approved. We are now into public comments. Hello, Mr. Gunning. Okay, public comments. The only public comment I think is Mr. Diabueno.
Well, good morning, everybody. First, a couple thank yous to a few people. Laura, thank you very much for attending our March for Meals initiative. Melissa, thank you. And Andy, thank you for the letters of support related to the projects that we're working on. Really appreciate all of that. I wanted to share with you that we have a number of different things happening at the center, but the key one that I wanted to bring forward to your attention today is the Silver Key Summit. So I've got some handouts that Melissa's gonna make sure that everybody hopefully gets a handout that you can take with you to pass along to your friends, family, anybody that's interested. What it is that the Senior Summit had been one that we've been doing for a few years now, but what's happened is the amount of people that go to the summit is about 1,600, and now we're at closer to 2,000 people that we're planning this year. And so we've added 2 days, and what's happened is we've broadened the number of people that we have that will be at the event, that will be presenting from sponsorship. PPACG, the AAA has a representation there, and certainly other organizations as well. So I wanted to let you know first that is an invitation to any of the organizations that you're involved with to be able to bring this forward to the clientele that they support. We'd love to see them there. It says free food, free event, free parking, free. That is true. And also what it means is that this is something that Great Wolf Lodge has been under the new knowledge about how many kiddos that Silver Key is serving because many grandparents are taking care of grandkids. So they have sponsored and supported at $32,000, meaning that they've allowed for us to be able to broaden our support for kiddos to attend the event. So they'll get a band. They won't be able to go into the pool, but they'll be able to go to the adventure area. So if you have kiddos that grandparents are taking care of, please bring them alongside. It's a great thing that we have going forward. It's a 2-day event, and so I just wanted to make sure to highlight the event itself for you in terms of the content. On the 14th, we have an elderhood panel. We have Nourish to Flourish, Safer Med, Stronger Aging, AI and Aging. Those will be the big breakout sessions that we have throughout the day. We have special topic presenters for each one of those. We will have a fall resiliency support later on in that afternoon. And of course, line dancing, cardio, drumming, and chair yoga, senior games will be there. And memory lane games is one of the events that's happening that day. And then on Friday, we have a centenarian, I can never say that word very well, panel where we have 3 people at this point who are over the age of 100. One of them is a marathon runner. So it'll be very interesting to hear his perspective on the world and what he's working on now. We have a documentary that was established and created by the YDA, which is a youth group. It's a wonderful presentation of what it means to age in this community. And also what it means is that we've got representation. Few of the Silver Key people that we serve are part of the video on this documentary. I'd love to see you all there to see that video. We have Aging Well in the Pikes Peak region. We have representation from those that are elected officials that will be part of that, and then the power of showing up. And that will be one of the great things about how do we advocate for the older adults in our community. And then Rocosa para ti, resources for Spanish speaking population. So we'll have a breakout session specifically available to be able to inform about the Spanish speaking services. I know I'm over 3, just real quick. Line dancing, Tai Chi, flower arranging, Ikebana, flying the right way. Falling the right way. I thought, uh-oh. At Colorado Senior Games. My friends, thank you so much for all your support over the years, and I'm really excited to see all of you there and anybody else that you'll be along, be with you. Please do, and bring kiddos as well. Take care. Thank you all.
Thank you very much. Look forward to seeing you. Okay. Action items. Debbie, will you kick off the fiscal year's 27-28 funding recommendations, please?
Well, I'm going to just first go over how we got to where we are today.
Okay.
So I just want to say that the action items that were included in your pamphlet of documents, it laid out very well the info and the documents you received. So I'm just going to review. The TRS committee passed the initial recommendations and allocations way back in December. And then it was brought to the RAC and it was passed by the RAC. However, 2 of the agencies who requested funding had appeals, and those were brought to the PPC Council of Governments, and they asked the Council of Governments asked the TRS to review these recommendations. The TRS met this past Monday, the 23rd, and we heard from both of those agencies. We had their letters, but we reviewed, they spoke and reviewed their concerns. Then we heard from Carol McBroom, and she's sitting right there, and and she had some new allocations, and she's here today to discuss what those are.
Hey, good morning. Carol McBroom, PPACG Finance Director. So after going through the appeal process, we recommended increasing both Park and Fountain Valley, and their allocations would be based on specific requirements that they would have to meet, and the funding would be held, the additional funding would be held in a reserve until those requirements have been met. And we put a 6-month timeline on those requirements, with assessing for the first time at a 3-month period, which would be in October. And the question was asked, how are we funding the increase? And so basically we had to go back and look at the additional service funding that we applied to different providers. And so I'll talk about those now briefly. Disability, we are removing a $50,000 to start a voucher transportation program. That will have to be removed because there will be no funding available to start a new service there. We're dropping GoGo Technologies altogether, and that's an additional $50,000 put back into the pot. Regents of the University of Colorado Springs, the UCCS Aging Center, we're reducing their funding in the screening service. It is not considered a priority service, so we're removing that. And then there is an increase. In addition, Teller County Coalition, we had to increase about $30,000, and that is an internal miscalculation on the original allocation. I'm happy to answer any questions.
Any questions from anybody here today or online? Okay, so I guess the next step is, it was approved by the TRS 3-0. And now I would like to bring that motion to the actual rack. So I will make the motion to have the allocations set by Carol McBroom. And I think we need a second on that.
Gordon Rick, I second the motion.
And we need a vote. All those in favor?
Aye.
Aye. And so the motion passes. And so my understanding is that it will be brought to the next PPACG meeting in April, I think.
April 8th.
Thank you.
Thank you both. That was simple. Okay, presentations. First presentation will be Project Angel Heart. Mix Sosi, is that correct?
Nick Susie, I believe,
Susie.
and she's online. And there she is.
Okay,
Here
Nick.
comes.
Take it away.
Thank you, everyone. Hi. Oh, great. You've got my presentation. Making this easy for me. Thank you. So yes, hi, everybody. My name is Nick Susie. I am Project Angel Heart's Senior Manager of Government Affairs and Policy Strategy. I've been with the organization since January of 2020, worked in our client services department, and then moved into kind of our government affairs role back in 2022. So I'm very excited to be here with you all today. Thank you for having me. We can go to the next slide. So in this presentation, I'm just going to share a brief overview of who Project Angel Heart is, what we do, the services we provide, and a little bit of what we've been up to lately. And then we'll take some Q&A at the end if we've got some time. But Project Angel Heart's purpose is for all Coloradans to have access to the nutrition that they need when they are, particularly we serve folks who are chronically or severely ill. And so we prepare and deliver medically tailored meals for folks living with severe illness across the state. And then we also provide nutrition counseling and education to complement that work. We also have kind of an advocacy component where we're advocating for increased access to food as medicine. Next slide, please. Okay, so this year, we will prepare and home deliver 815,000 medically tailored meals to over 5,000 Coloradans. All of our services are provided completely free of charge to our clients. So thanks to generous funding support, including from PPACG, Area Agency on Aging, we are able to provide these services completely free of charge for our clients. Individuals receive our meals for as long as they need them. And then we also are able to provide meals for dependents in the household as well. So if we have an older adult who is a caregiver for children, for example, we would be able to send meals for the children in addition to the older adult to make sure that everybody in the household has the nutrition that they need. Next slide, please. So a quick breakdown of our client population. We qualify folks for our services across the state based solely on the diagnosis of a severe health condition. The most common diagnoses that we serve include chronic kidney disease, cancer, COPD, congestive heart failure, and protein calorie malnutrition. Not on this slide, but close below protein calorie malnutrition is dementia and Alzheimer's disease. While we don't restrict our services for folks based off of income, about 80% of our clients end up living at or below 200% of the federal poverty level. That is the equivalent to roughly $30,000 per year for one person. About 30% of our clients report having no or very limited internet access. 15% of our clients are veterans. Next slide, please. I'm moving through this quickly because I know we have a limited amount of time, but we could certainly talk more at the end for questions. So our clients receive weekly deliveries from our program. We cook all of these meals from scratch in-house, which I'll go into a little bit more in a moment. But our clients will receive either 1 or 2 meal bags. If you've seen our meal bags before, you'll know that they're all hand decorated by volunteers, which is a really special component of our program. And a lot of our clients report that it really improves their social connectedness, just knowing that somebody kind of decorated this bag especially for them. And these bags contain 7 or 14 frozen meals The reason we provide frozen meals is so that our clients have a little bit more flexibility and autonomy to choose what they'd like to eat and when. And in addition to those meals, we send some side items like bread, fruit, string cheese. We also include a small dessert in our bags. We like to say that in addition to feeding and nourishing the body, we also have to take care of the soul. So those little desserts like the chocolate chip cookies go a long way. Next slide, please. So looking more closely at the meals that we're actually providing, I mentioned that we cook everything in-house. So we have a team of professional chefs who work alongside a team of registered dietitians to prepare meals that are both, nutritionally balanced and medically appropriate for the nutrition that our clients need, but then also that they taste good. We like to say that food is medicine, but we do not want it to taste like medicine. We want our clients to actually enjoy the food that we're sending. And so each meal is comprised of, lean proteins. We use a lot of chicken, fish, pork. We also do vegetarian meals. So we'll include things like tofu. We pack lots of vegetables into our meals, both on the side, but then also baked into, if we're providing a stew, usually the stew will be 50% vegetables, 50% protein. So we make sure to kind of get the sneaky vegetables in too. Plenty of whole carbohydrates, so things like quinoa, brown rice, and then we use an olive oil blend to cook all of our meals in, so we get those healthy fats in there as well. Next slide, please. So what really sets Project Angel Heart apart from other meal providers is that we are able to medically tailor our diet, our menu offerings in over 80 different ways. So that means when our chefs put together a week's worth of meals that they're planning to cook, they're actually creating about 80 different varieties of any one of those menu items. We can accommodate all of the diet offerings listed here on the screen. So kidney friendly, where we might reduce nutrients like potassium or phosphorus that are not appropriate for that diet. We have an allergen friendly diet, which removes dairy and eggs, an unseasoned diet, which is great for folks who either don't like strong flavorings or perhaps are undergoing chemo treatments and might not be able to kind of tolerate those heavier seasoned meals. We also find that this is a popular diet among kids who like to, put their own seasonings or a big squirt of ketchup on the meals to make them more kind of appropriate for them. We have a vegetarian diet, and then our kind of standard diet is heart healthy. We also have all of these modifiers. So any one of our meals can be made gluten-friendly, GI-friendly, where we would kind of take out any vegetables that are harder to digest, like broccoli, or that would limit beans in that diet. We have a soft or fork tender diet. So our chefs either cook everything down so that it's fork tender, or if we're sending like a chicken breast, we'll cut it up into pieces ahead of time so that our clients don't have to do that. We can accommodate all sorts of protein restrictions. So if folks don't like or cannot have pork, beef, or fish, we can remove those. So all this to say, there are many, many different ways that we can tailor our meals. And this is really kind of the gap that Project Angel Heart fills, where if we receive referrals to our program for folks who might not have specific dietary needs based on a health condition, that's when we might refer them to another meal provider. And then similarly, if other meal providers receive clients who have specific dietary needs, that's when we ask them to send them to us. That's really kind of our specialty area. Next slide, please. Okay, so in lieu of being able to show everybody the kitchen and our facility in person, I wanted to include a couple of photos of our chefs hard at work. We have an incredible, very, very large industrial kitchen facility here in our office in Denver, and that's where we cook all 815,000 meals every year. So you can see we've got on the far right, we have Chef Vin, who is cooking and actually emptying out our stock pots where we make all of our homemade stock in-house. So when we're cutting vegetables and breaking down protein, we're keeping all of those scraps, and then we're turning that into homemade stock that we're then cooking our meals in. So that reduces sodium, adds a whole bunch of flavor, and saves money that in a way that we don't need to purchase like a stock base, for example. In the upper left corner, we see Chefs John and Chef and Chris, and they are cooking meals in tilt skillets. So tilt skillets are essentially giant frying pans, but because they hold 40 gallons of food, you certainly can't lift a 40-gallon frying pan. So these are on kind of like a little crank system, and where you can actually turn the tilt skillet to empty out the food and to help mix it back and forth. It's really a kind of amazing thing to see. And we've got about 8 of these all lined up next to each other. So we've got all of our different diet offerings kind of happening at once. And then in the bottom left photo, we've got a couple of our chefs who are picking some fresh herbs. Again, we try to reduce the amount of sodium in our meals, so lots of fresh herbs go in there to help keep them delicious and healthy. Next slide, please. I mentioned in addition to providing meals, we also have 3 dietitians on staff who provide nutrition education and counseling. So they will meet individually with clients to provide kind of specialized, individualized nutrition counseling. And then we also have these kind of group calls, which we call food with heart conversations. And so this is a great opportunity for our clients to connect with each other and discuss, nutrition conversations all together. We also send out nutrition education in the form of like pamphlets and flyers that go in our meal bags. We have cooking demonstrations where our chefs and our dietitians work together to put on essentially like a little cooking TV show. So lots of different ways for our clients to engage in the education component. Next slide, please. Just a quick look at where we home deliver our meals. So we currently serve about 2,500 square miles along the Front Range, as far north as Fort Collins, as far south as Pueblo. And you can see in the Colorado Springs, Pikes Peak region, we have expanded our delivery area slightly so that we're going a little bit further north and a little bit further south. Outside of these areas, folks are still welcome to come and pick up meals from our office in Colorado Springs, so they don't necessarily need to live in this delivery area in order to receive our services if they have a way to get those meals in person. And then next slide, please. The program that we're really looking to expand upon. Next slide, please. Thank you, is our shipping program. So we have kind of developed a way where we can ship meals within 48 hours of receiving a referral anywhere in the state and keep them at a food safe temperature. So all of the hearts across the state of Colorado represent towns that we have already shipped to, but we are looking to increase this quite a bit because we know there's a lot of need outside of kind of our metro areas. And so we're looking for more ways that we can help get meals out to different parts of the state. Next slide, please. So we have done a lot of research at Project Angel Heart and then also partnered with institutions across the country to look at the actual impact of our meals. We have found that across all, and actually this data, I should say, is pulled from the Colorado All Payer Claims Database. So we looked at essentially health insurance claims for folks who were receiving our meals and for folks who were not receiving our meals, and found that clients who received our meals saw a 13% decrease in hospital readmissions, and then an average 24% reduction in essentially total medical costs across different diagnoses, including diabetes, congestive heart failure, and COPD. This research is specific to Colorado, but very much mirrors what we're seeing across the country, which is when folks have access to proper nutrition, it keeps them healthier, it keeps them at home, and it reduces a lot of their healthcare spending. Next slide, please. I think I have a little bit more data here, yes. So just a few more quick statistics that clients who received medically tailored meals from Project Angel Heart spent an average of 48% less on inpatient care, 5% less on outpatient care, and 33% less on pharmacy costs. So again, food is medicine. We really believe it, and the data kind of backs that up too. Next slide, please. So in addition to looking at the actual data of cost savings around medically tailored meals and why it's good for the healthcare system, we also care obviously quite a bit on the impact that our clients are perceiving when they're receiving meals from our program. So these statistics are from our 2025 survey results, where clients reported that as a result of receiving medically tailored meals from Project Angel Heart, they reported improvements in their stress and their ability to remain independent at home. in their overall quality of life, their health, their ability to afford basic needs such as rent, transportation, and then improvements as well in their healthy eating habits. So when we survey our clients, we have been told that paper surveys are still the way to go. So we actually mail these surveys to our clients with an envelope that's stamped and ready to go back to us. And we actually have about a 30% response rate for those surveys, which is pretty good considering we're mailing these out to folks' homes. In those surveys, we collect this data, and then we also ask a lot of questions about what their favorite meal was, what their least favorite meal was. Do they like carrots better, or do they like sweet potatoes? And then we can use all of that data to kind of adjust the services that we're offering. Next slide, please. Okay, so very quickly, I wanted to share a couple things that we've been up to recently, kind of on our advocacy front, because really our goal is, again, to increase access to food as medicine interventions for all Coloradans. And so to do that, we believe that collaboration is really, really necessary. We have so many wonderful providers across the state, and if we can all work together, we will be stronger. And so in January of this year, 2026, a couple months ago, we hosted our 3rd annual Colorado Food as Medicine Summit. This event this year convened over 300 attendees from over 120 different organizations. We had state agencies there, we had national advocacy groups, we had doctors and physicians and dietitians, we had other community-based organizations, all coming together for a full day to talk about how we can work together to increase access to food as medicine and other nutrition interventions. So this was very energizing, very exciting, and we're kind of looking forward to keeping up that work through, and I'll have you go to the next slide, please. A coalition that we started last January, which is called Food as Medicine Colorado. This is a multi-stakeholder coalition aimed at essentially enhancing the role of nutrition in healthcare. So back to that kind of core goal of making sure that Coloradans have access to the nutrition that they need. This group is kind of continuing on the work of the summit, which happens annually. And instead, we're meeting monthly. Both, we had an in-person convening. We usually meet virtually, and we talk about kind of how we can work together to increase access to food as medicine. Right now, we're doing a landscape analysis to try to collect information about all of the food as medicine programs across the state, so that folks living in different areas can very quickly and easily see what types of medical nutrition programs are available to them. So I could talk all day about some of the advocacy work that we are working on, but I'll say let's go ahead to the next slide. And I wanted to share my contact information there. Again, my name is Nick, and I have my email there. You are more than welcome to reach out to me. I know this was a pretty quick presentation, but I'm always happy to chat more about our program, about our advocacy efforts, or anything that would be helpful. I will also quickly plug that we have kind of our upcoming annual fundraiser called Dining Out for Life. This fundraiser is really fun because all you have to do is dine out at a restaurant, and 25% of your sales from participating restaurants will be donated back to Project Angel Heart. We have usually about 200 different restaurants across kind of up into Boulder, Denver, Colorado Springs, and Pueblo. And so if you go to projectangelheart.org, you can see the full list of participating restaurants. But this year, that event will take place on April 23rd. And again, all you have to do is dine out and enjoy a nice meal, and Project Angel Heart will benefit from that. So I wanted to put a quick plug there as well. Okay, I feel like I just talked so fast at everybody, but I guess I'd love to open it up if there are any questions or comments or thoughts. But otherwise, thank you all very much for your time. I really appreciate it.
Debbie, you have a question?
Yeah, I do. I'm just wondering if you know the percentage of people that you serve that are seniors. I recognize that you serve a wide range of ages.
Yes, the most recent number I saw was about 70% of our clients are older adults above the age of 60. So yes, the vast majority of our clients are older adults, despite that not being kind of a qualifier for our program.
And I have one other question. How is the increase in the price of food affecting, or is it even affecting your ability to provide the meals that you produce?
Yeah, it's a very good question. We are absolutely feeling the impacts of the increased cost of food. It's difficult because when we go as individuals to the grocery store and we see that the price of chicken, for example, has gone up, you know, 25% or so. We feel it, and it's not great. But then when at Project Angel Heart we're purchasing literally thousands of pounds of chicken, we feel that increase much more substantially. So because of that, yeah, I will say our budget position this year is we are facing a deficit budget. Project Angel Heart for the past 35 years that we've been around, we've always been able to meet our budget and fundraise to provide, to support 100% of our program through a variety of different funding sources. This year we are going to be a little bit short on that. Our board of directors has approved the use of some cash reserves in order to help us kind of fill that gap. And our fundraising team is working very hard to see how, in future years we can minimize that gap, because we don't necessarily think that the price of food will be going down significantly enough to kind of cover that. And, simultaneously, we're seeing a lot of challenges around a lot of our funding sources. So, the increased costs, decreased revenue is creating kind of a challenging situation. But we know that we're not alone in that. I think a lot of nonprofits are facing very similar challenges. And that's what's really led us to lean into the collaboration side of things that I was talking about with our summit and our coalition that we built, because we know that we're going to have to really work together to get through this.
Thank you.
Yeah.
Melissa?
Thank you, Madam Chair. I have a couple of comments, and I'm going to actually also then ask for two of our partner agencies that are on the line listening to actually make a few comments too, if that's okay. First, I just, as Nick commented, that they are running a little short on their budget this year. I hope we all get to go look on the Project Angel Heart website and figure out where to go out to eat on April 23rd. Looking forward to that already. And then I wanted to just really reiterate, because I don't know that for folks that are sitting in the room are living and breathing this daily. Jason made I don't know if he's still here, made a kind of a brief little comment about, the March for Meals. March is National Nutrition Month. So just kind of another little reminder for everybody that Nick presenting today, part of that is because it's Nutrition Month, and wanted to get that out in front of folks. And so thank you, Jason, for having those special events that Silver Key did around raising awareness around, nutrition and doing all of that. That being said, we have Kathy Lowry from Teller Senior Coalition, and we also have Penny Everest from Park County Senior Coalition. And I am hoping that I wanted to ask them two questions. One is where they're getting their home delivered frozen meals from. And then also if those two are doing any type of fundraisers in the near future up in their communities as well. So if we can start with Kathy and Teller Senior Coalition, if she's available. She may be online, but she also might be multitasking. So we'll see if Kathy's available to comment a little bit to start.
I'm here.
Okay, thanks, Kathy. So again, the two questions. One is where are you getting your home delivered meals? And then also if Teller Senior Coalition is doing any upcoming fundraisers.
So the coalition is getting their frozen meals from GA Foods, a company in Florida that makes these frozen meal boxes, 7 meals in a box. And these meals meet, the nutritional standards that we're required to meet. And we did just, sign off on a price agreement with them. And they actually did not increase the cost of the meals that much, a little bit, but not bad. But what I'm really worried about is the shipping costs. With gas where it is right now, I'm anticipating that those costs are going to go up pretty significantly. and that is a concern. Fortunately for this current fiscal year, PPACD, and thank you very much, did provide us some additional funds. So we're able to meet the need for seniors right now in terms of our home delivered meal program. But it's something that we're going to have to keep an eye on. On the fundraising, the board is actively pursuing options for fundraising. We discussed it quite a bit at our last board meeting, and we will have fundraisers this year. We just haven't quite narrowed down what they're going to be. But I'm going to have to explore this restaurant idea. Sounds like an interesting idea.
Thanks, Kathy. And so Penny, if you're also available, I would like to throw those two questions your way too.
Yes,
Unless-
I am.
Okay, you're here too.
Good morning. All right. We get our frozen food from Magic Chef. He prepares 5 meals in a box, and there's some like milk and orange juice and some ice cream on the side. And again, it's going to be a huge concern of us about the freight that's happening. And we also looked at changing and going away from Magic Chef to GA Foods because we like what they're offering. And of course, it matches what our dietitian wants us to do. As far as fundraisers coming in through, we're looking at doing a casino night roughly about May or June up in the Fairplay area. And that'll be a ton of fun. We're working with committees right now to put the whole thing together. And that would be it for me.
Thank you. Thank you both.
Is there anyone else? Questions, comments?
So Andy looked up on April 23rd, for those of us in Colorado Springs, we can all go to Jack Quinn's.
Oh.
To support Project Angel Heart. Okay, now good luck pulling the meeting back together. Yeah. Okay, thank you.
Love it. Okay, well, Nick, thank you very much. This is was a really a good presentation for all of us. Refresher for some, but good initial information for some. We do have the slide deck, do we not?
You should
So
have
yes,
it.
I do have it. Yes, I'll forward it out to everybody. Thank you, Nick, for sending it to us.
Great.
Of course. Thank you all.
Thanks, Nick. Okay, next is the Area Agency on Aging Ombudsman, Lori McGinnis.
I'm glad this is right here with big print that okay. Okay. So first of all, I'm going to tell you that my presentation is not nearly as beautiful as Nick's was. So, but I'm Lori McGinnis. I am the regional ombudsman for the very best ombudsman team in the state of Colorado, maybe even the nation. So I've been around a while, been working here doing this for about 12-ish years. I don't know. I feel like I've been saying I've been doing this for 12 years for the last 3 or 4 years. So I don't really know. Prior to this, I worked at the state I was the operations manager for the SHIP and SMP program. Prior to that, I worked here in the SHIP department and mobility management. Back in the day, many moons ago, Melissa was my supervisor at TRE. So I've been doing human services for quite some time. Next slide. So why is there a dog? When I'm not working, I am spending time with the Coda bear. And Coda is the brother to the infamous Nova, Melissa's dog, who spent 10 days up in the mountains. So, but all of my money and time goes to this. And there are 2 things I love to talk about, and that's dogs, any dog, and the ombudsman program. Next slide, please. So the Ombudsman program is a national program. It's in all states and territories. Some states cover more programs. They may be going into homes who, for people who are on HCBS, but in Colorado, we just do assisted living and nursing homes. But we follow the federal regulations in the Older Americans Act and then the Colorado state policies and procedures. We have a state ombudsman who our program works under, and she directs all of our program activities, then the regional ombudsman, and then the team. And I supervise the team. And one team member, Kathy, back here, and Kathy is, she rock and rolls. She's out there getting more complaints than almost any other ombudsman in the state. So she really keeps herself busy. Most ombudsman programs are housed at an area agency on aging, but not all. Next slide. So I wanted people to know that we have significant history going back to 1972. When nursing homes first started, they started seeing problems with care issues. So there was a pilot program, and then throughout the years, it's just developed more and more. More things have happened since 2016, but I pilfered this slide from the National Ombudsman Resource Center, and that's where it ended, and I didn't want to update it. So, but more things have happened since then, giving us more authority in to access residents, access records and information. So things just continue to proceed. So next slide. So I have this here. I'm not going to read it to you, but you could read it. But it was written by Catherine Howes and Charles Phillips, and they wrote a research article back in 1986, The Changing Structure of the Nursing Home Industry. And they talk about how businesses start profiting off of nursing homes. And businesses are good. All businesses need to make a profit. That's what they're set up for. But while at the same time they're making these profits, they're going to state legislators and saying they're going bankrupt. But on Wall Street, they're saying that they're some of the most profitable investments around. Some of them making at least 20 to 25% a year on these investments. Next slide. So, and these are your tax dollars. And I'm talking about this, you're here to hear about the Ombudsman program, but I want there to be a little bit of understanding about the structure of the business of long-term care. And this applies to the larger assisted living as well too. So back in the 60s, they were saying they didn't have enough money, yet they were making large profits. And it's the same today. And understanding the whole business structure and the profits and how that eventually impacts resident care is important for people to understand. And you can read more information at the National Consumer Voice website. Ernie Tosh, an attorney who gives wonderful presentations on this, and he can talk about the structure so well. I'm not a business person. I'm in social work, have worked in human services most of my adult life. Business is not my thing. Money is not my thing. But you could read more about it there. Next slide. So now we have private equity firms and real estate investment companies, and Ernie talks wonderful about this, but I will caution you, if you do ever watch any of his videos on this, he swears a lot. So if you're offended by that, just be aware. So the private equity companies, they may come in and buy up some nursing homes, and they also own the pharmacy companies, so they're upcharging for medications. They may own the food service company that they're contracting with, and so they're upcharging for those services, same with laundry and ground maintenance, on and on. So they're actually showing a loss, but the same private equity company owns all these little other companies. Now we have a lot more real estate investment companies coming in and similar structure, kind of, sort of. I don't really understand it. The company owns the building, leases it to the nursing home, charges the nursing home exorbitant amounts of rent. And so then again, they're showing the difficulty in a profit. They're saying we're not making a profit, but they are in different ways. One of the things that's always kind of caught my interest, and I don't know the answer to this, is, Medicaid buildings and private pay buildings always say we don't have enough income. We don't get reimbursed enough. Well, private pay buildings, you're going to pay a lot of money. Medicaid may pay, let's say, $4,000 for an assisted living, but if you're private paying, you're paying $6, $7, $8+ thousand a month. But staff don't get paid anymore in private pay buildings. So I've always wanted to understand why that was. So, and the staff, good staff equals good care, and they need to be paid decently. We have so many young single mothers working in these homes, and they're not getting paid well. They're struggling to put food on the table. They get stressed. That kind of stress leads to abuse and neglect, short tempers, all of that stuff. How do we pay? We pay because we're already paying a lot of Medicaid facilities with tax dollars. And then law enforcement is responding to issues in the building, whether that's resident to resident abuse, staff to resident abuse. Sometimes we have law enforcement responding because staff are arguing out in the parking lot with their boyfriends, or we have adult protective services who are handling lots of cases of abuse, neglect, and exploitation. Fire department, 911 calls daily for everything from falls, and they need lift assist. Hospitals, individuals get left at the hospital because the nursing home or assisted living don't want to deal with them anymore. And so the hospitals have them sitting in their emergency departments for long periods of time. Sorry, I'm talking fast. Next slide, please. So that is sort of my pet peeve, and I'll get off my soapbox a little bit, but I want people to start understanding those issues, because those issues lead to poor quality of care oftentimes, not always, oftentimes. And so we're paying for it, for the Medicaid buildings, in lots of different ways, but the individuals who are living there are paying with lack of care, bed sores, ill health, isolation, lack of dignity and respect. So there's lots of impact from this. So now I'm going to tell you about the Long-Term Care Ombudsman Program. So we are resident-directed advocates. That means that we work at the direction of the resident, unless that resident can't give direction, and then there's exceptions for that. Oftentimes we get phone calls from family who will say, my mom isn't going to meals and she needs to be going to the dining room. And we go talk to mom, and mom doesn't want to go to the dining room. And so we act on what mom wants. That's our job, is to be the voice of the resident and help them get their needs and wants met. And that can be really hard for people to understand. Families don't always understand that. Staff, law enforcement, APS don't always understand that. We are not the safety police. We are rights advocate, and people who live in long-term care have all the same rights as every other US citizen, plus additional rights that are written into the Older Americans Act. We do a lot of advocating for quality of care through various ways. That's going to meetings, talking to people. A lot of what we do is education about resident rights and how people can support residents' rights being respected. So provisions, next slide. We are not licensing or regulatory, so we don't inspect for the same things that they do. And that's sort of a fine line because when we go into a facility, we're also looking for safety hazards and stuff. And like, is there torn carpet? Could somebody trip? Are people, so we're looking for those kind of things and we bring them up, but we can't fine or hold accountable. We're not adult protective services. Again, I kind of think of them as the safety police, and we are not the safety police. So we're not going to have the same response that they would. And we can't provide direct care for residents. And this is always so hard for me. It's so hard for all of us when we first start. So say we're in a room talking to someone and they ask for a glass of water and the water is right there, we cannot give them that water. And it's because if they may have fluid restrictions, they may need thickened fluid. And if we give that to them and they choke, we're putting our program at risk, PPACG at risk, the national program. So we have to be very careful. If we were to push somebody in a wheelchair, their foot could get caught or something. And again, there's a lot of risk around that. It's really hard though. Because we're all kind of caretaker kind of people and we want to comfort and give people what they need, but we can't do that. Next slide, please. So the two major things we do are information and assistance. And that could be a really quick call where somebody just needs information on something and we give it to them and we hang up and we're done. It could mean an all-day training, or it could mean a 2-hour phone conversation with a family member. So it's a lot of education and support happens in that information and assistance. Then we handle complaints. So a complaint is something where somebody calls us and we have to take action, and then it becomes a complaint. So, and complaints come from everywhere. We get them from friends, doctor's offices, law enforcement, family, staff, just from anybody. So somebody calls us, they have a complaint, let's say a resident calls and their call light wait time is what they feel is extensive. So maybe they're waiting an hour to get changed or 2 hours, or maybe nobody ever comes. And they want us to help. So then it becomes a complaint and we find out what they want. We give them their options on how they can address it and follow their direction on addressing it. And they can be really simple things that we can solve pretty quickly, and others take months to resolve. And then you think you have it resolved, so you close your case, and then a couple of weeks later, it comes up again. All of this work goes into a database, which then eventually at the end of our data year gets uploaded to the federal government, and then it's looked at there. So we can also, if we're in a facility, we do unannounced visits. And if we're walking the halls and we see something that impacts several residents, we can address it, and that becomes a complaint. And then we have to do all the documentation for that. We investigate to gather facts, but we're not substantiating a situation like law enforcement would. We're just looking at the facts to kind of find ways to help resolve the issue. So if that same person with the shower, I mean, a resident who's not getting showers, but staff say they are, we may go look at the shower log and see what's going on. Was that staff person that's on that shower log actually working that day? So we will do some investigation, but our ultimate goal is to resolve the residents' concerns. Next slide, please. Oh. So we are not mandatory reporters. In fact, we are prohibited from reporting abuse and neglect. And it's written in the Older Americans Act, and that is to protect our relationship with the resident. A lot of people who live in long-term care facilities are fearful of retaliation, and retaliation is very real, and there's a whole other presentation on retaliation in long-term care. So we're not mandatory reporters. And then we do a lot of encouraging people to fulfill their responsibilities, nursing home administrators, and social services and the direct care staff, kind of reminding them of what their job is and how to do that. We visit nursing homes at least once a month, and assisted livings we are required to visit once a quarter, but often we're in some of those much more frequently. Next slide. I don't know how much time we have. So unlike most of the area agents on aging, we serve people of all ages. They just need to be living in a nursing home or assisted living. And then we follow all, and that's in the Older Americans Act as well. Next slide, please. So our region, we have nursing homes and assisted living in El Paso and Teller counties. We have about 100 facilities and over 5,000 beds. We have 4 full-time ombudsmen and 1 volunteer ombudsman. And so I just ran a quick report, and January 1st through March 30th of this year, we handled 342 complaints and 519 information and assistance. And that was a little bit lower than the previous 2 quarters. Sometimes things, it sort of comes and goes in waves, but we are really busy all of the time. So I think this team does a really good job, and the state, through our monitoring every year, has given us excellent reviews. So we're really proud of the work that the Ombudsman program does here in this region. And the team are all very dedicated to their work and very enthusiastic about the job that they do. Next slide. Our top 3 complaints, I know there's 4 there, but the top 3 are care. And so that's usually in relationship to things like falls, response to requests for assistance, lack of care planning. Medication errors are big. Getting the wrong medication, not getting your medication. I mean, it's not unusual to hear of somebody not getting heart medication for weeks at a time. The second is autonomy, choice, and rights. That privacy, dignity, and respect. Retaliation is in that category, and the right to see visitors of their choice. It's not unusual for family, guardians, or powers of attorneys to try to restrict a resident's right to have visitors of their choice. And then it becomes a real fine line to have those conversations with guardians and powers of attorneys and families about an older person's right to choose their friendships, sometimes even their sexual relationship, when other people feel like they shouldn't engage in those relationships for whatever reason. So we do a lot of mediation and education and line dancing, but it's not the fun kind of line dancing. Financial exploitation was the third. And so that could be, there's a lot of theft that happens in facilities, whether that's residents stealing from other residents. There's a lot of staff stealing from residents. I remember one time it just broke my heart. A woman had gone into a memory care facility and she had a gorgeous wedding ring that she had worn for over 60 years. And it was gone. And her knuckles were swollen from arthritis. And the staff said, oh, it must have fallen off in her bed. Well, it couldn't have fallen off in her bed. But to have, she was not going to live long, but to have that removed from her when she had been wearing it for so long. And then her daughters were not going to have that family heirloom. It was just gone. And there was no way to prove who had taken it. So there's a lot of that. A lot of family members will try to take resources from residents. So that's just really a struggle to sometimes see. Dietary, and I just put this on the end, so it was interesting to hear from Nick, but dietary complaints are increasing. It's always kind of an issue, but going up, quality of food, quantity of food. Residents should have access to the amount of food that they want, but that's decreasing. There are smaller portions, even in some of the very nice private paid facilities. They're cutting back on food portions and quality. So I expect that just to continue. And food for people who are in facilities is a huge thing. It's a social thing. It's a nutrition thing. It's but the social aspect of it. They look forward to their meal all day, like they're planning their next meal as soon as the next one is done. So that's hard to see too. Next slide. So that was a really quick overview. And for a resource, you can go to the National Consumer Voice. They have lots of information in there. There's white papers, there's research, there's legislative information, there's information on how to look for a facility if you're helping a family member look or planning for your own future. There's lots of information there. Next slide. So in this region, we have Kathy, who's in the back, and then Connie, who's our volunteer, and then Michelle and Robin. And you can call that number and hear the extensions there should you have any need to or just want to chat about something. And so we're done. Any questions?
I have a comment. When I lived in the Albuquerque area, I think I moved there full time around 2015. And instead of volunteering at an area agency, I actually volunteered to be a volunteer ombudsman. And we were really lucky in the Albuquerque area. We had a very large, extensive network of volunteers, so that except for the most difficult places, most of the homes were a volunteer went in on a weekly basis, which was really pretty amazing because we could see if there were changes. And the training, all the things that you mentioned were part of the training program. And the volunteers met on a monthly basis for new training or to share with one another what was going on at their various homes. And it was really, really amazing. And I know I had asked Melissa when I first started on this committee, just asking it what was happening in terms of setting up a volunteer program here, because it was just so effective to have that going in the Albuquerque area.
So in the 4-year plan, that was one of my goals, was to develop a volunteer program. And we started with Connie, who is absolutely a wonderful person. And her insight is so valuable, and I value her in many ways. But what I found is that the training is so intense. So there's now a national standardized training, and Colorado has made some adaptations to that to fit our state, but it's very intense. It takes several months to get through that training, then several months of shadowing. before somebody can go out. And then it's several months more of me having regular contact with that person after every visit to discuss what happened. And then before they feel comfortable going out and doing their work pretty independently. So it takes a lot of supervision. And as much as I would like to see a volunteer program grow here, frankly, I don't have the bandwidth to do that at this point. If another person came along that I felt was a really good fit, I would most definitely consider that. If they had the dedication to do the training and then take on the work, but it has to be the right person too.
Yeah, I would say that a lot of the volunteers down in the Albuquerque area were retired nurses, retired social workers who had worked with seniors in the past, and so had a sense. And again, it was talking about some of the limits that you mentioned and our desires to want to just take over and do things. And that was really hard, but it was just really, really helpful to have that weekly contact.
So the state office offers a monthly copy in cases that they do online for the volunteers, where the volunteers gather and discuss cases.
It was always amazing to me. I visited 2 assisted living facilities each week, and one was in Albuquerque. I lived outside of Albuquerque, and one was just very local. It was like not very far from my house. And it was just amazing in the difference in these 2 facilities. And that depended on the person who was kind of managing the facility. I mean, the person in my local area, she introduced me to all the residents and told me if they had any problems, they could talk to me. I'd be there weekly. Whereas the person in Albuquerque really didn't want to have anything to do with me. And so it was much more difficult to visit that facility than it was the one out near where I lived.
Management makes a big difference, but we're persistent. Any other questions or comments? Oh,
Thank you, Lori.
thank you.
Okay, Jared, it looks like you're up.
All righty. Good morning, everybody. Jared Vernon, Public Policy and Communications here at PPACG. And Tommy, you're more than welcome to kind of just stay on the agenda page. But he's already pulled up. So this is, I included in here our state and federal bill tracking reports. Primarily for information, you're going to see a lot of stuff that applies to aging, but also applies to a lot of other things like transportation, local control. That's not going to be, as specific to what we're going to talk about. I'll talk about the highlights. But there's a good 60 pages that if you want to, if you need some way to fall asleep at night, it's a great way to do that. But I'm going to start first on the federal side, partly because that's going to take a lot quicker than the state side. So on the federal side, I was fortunate to participate in the U.S. Aging annual policy briefing in Washington last week. Was able to meet with staffs from 3 different Senate and congressional offices, and some really good discussions. Myself, as well as the executive director at the Upper Arkansas Council of Governments Area Agency on Aging. He and I had those meetings with legislative staffs. Probably the biggest federal bill of note, and we've had it on our radar for a while, is Senate Bill 2120. This is the Older Americans Reauthorization Act. As we've said before, this bill is largely the same as what was introduced in the last session, and is one that we support and we're excited for. This particular bill is 1 senator away from going through the unanimous consent process. 1 senator has placed an anonymous hold on it. I couldn't tell you who it is if I wanted to, because I have no idea who that person is. But our understanding and working with our counterparts at U.S. Aging is that the senator's hold is not in relation to the Older Americans Act bill. They are using it for leverage for something else. But we are 1 senator away from just going through the unanimous consent process. Once that senator releases his hold, or her hold, again, I have no idea who it is, then it will go through pretty easily on the Senate side. Excuse me. And then this will set up going through the House, which is expected to be a little more difficult. There's a sizable number of members in the majority party who are just flat out opposed to reauthorizations on a philosophical basis. Even though their concern is more from a spending perspective. So it's a little bit unique in that an authorization is not an appropriation. And so now it outlines what can be appropriated within the guidelines of a reauthorization, but it is not an actual appropriation. So that's a little bit of a challenge because, again, the opposition to an Older Americans Reauthorization Act is not really about the concerns that they have. So we're expecting a little bit more of a challenge on the House side. This is where it fell apart last session, was on the House side. It went through the Senate side without a problem. But it is something that once it gets to the House, we've already had those initial conversations with House members saying this is why the bill is important, this is why it matters. But it'll be interesting to see how that goes. I think because that it is on the majority side and majority gets to dictate the calendar, short of well, I'm blanking on the rule, but they've done it more this session than any other previous sessions. But to force the vote, I think if it was on the floor, it would get passed. It's just getting it on the floor is going to be the challenge. So that's the update on Senate 2120. And I'm going to shift a little bit because it's always budget season. The fiscal year 2027 appropriations process is getting started. The president was supposed to submit his budget request the first Monday of February. It is now almost the end of March. That is not uncommon, though. That is not unique to this president. Every president typically does not meet that first Monday requirement. First Monday in February requirement. There is no penalty for not reaching it or for not meeting it. So that is not uncommon, but it does kind of kickstart the appropriations process. We are expecting, from what I've heard, that the president's budget proposal is likely to come out next week. And that will really kind of start the appropriations process on the federal side. We're already seeing House appropriations and to a lesser extent Senate appropriations kind of get started without the president's proposal. That is a little unique. And I will just kind of caution that once we see the president's budget proposal, we saw this happen last year, and this happens again with both Democrat and Republican administrations. Congress just kind of does their own thing anyway. We saw a lot of proposals in last year's budget proposal that Congress did not adopt, not just on HHS, which is where we focus on for this particular committee, but in any bucket of appropriations, the Congress still did their own thing. So we'll see that. It's going to get headlines. Take it with a grain of salt because the actual where the sausage gets made is in the appropriations committees. And so that's kind of the main updates on the federal side. Any questions on federal stuff before I dive into state? Okay. Like I said, that one was the quicker of the two. Okay, state session. We're on day 72 of 120, and so far 489 bills and resolutions have been introduced between this House and Senate. I'm going to give a little bit of overview of just kind of operations before I dive into some specific bills that are probably more interest to this committee. So you're going to hear me say what our positions are. So there's 4 positions that if we decide that we're going to follow a bill, that we have to put into the Secretary of State's bill status sheet for lobbying. Those 4 positions are support, oppose, amend, and monitor. So you might hear me reference that PPACG is in one of those 4 positions. That's the position that our board of directors has adopted. And that's how we are reported on the Secretary of State's lobbying page. You're also going to hear me refer to fiscal notes. Fiscal notes have been around for a long time. I'm going to get to the budget at the end, but there is a reason why if there is a fiscal note, why I'm mentioning it. And then, so getting into kind of, I got 5 bills of interest probably for this committee. They're all House bills, starting first with 1010. This is the older adult support and representation in workforce. This would largely involve any individuals in the workforce who are age 55 and older. would require some additional reporting requirements just to kind of get an idea of how many, what proportion of the workforce are those individuals. This would involve the Colorado Commission on Aging, which we're very active with, especially with our own Pikes Peak Commission on Aging. And that data would go through the State Workforce Development Council. This has already passed the House. It is waiting its first hearing in the Senate, and PPACG is in a support position for this particular bill. House Bill 1018, this is long-term care services for nursing home residents. This is a bill that would mostly impact, among other things, county Department of Human Services offices. It would add some requirements for the counties to, before a resident is discharged from a long-term care facility. PPACG has not taken position on this bill. It has gone through its first committee in the House and is waiting it's another hearing in the House Appropriations Committee. It does have about $250,000 fiscal note attached to it, and I'll explain once we get to the budget why that is significant this year. House Bill 1022, this is a opportunity for individuals 72 years or older to opt out of jury duty. They don't have to, but if they choose to, they can say, no, I would rather not. This has already passed the House first committee and is in the appropriations process. It is a relatively minimal fiscal note, 10,000 in year one, 15,000 in year two. And we have not taken position on this bill either. House Bill 1107, this is healthcare and regulated facilities. And so this is one that PPACG is monitoring. This would essentially create a definition of a dementia care facility. Right now, there is no such definition at the state level. And so a place can call themselves a dementia care facility, and that's all they have to do. This would essentially kind of create that definition and say that if a facility is going to say that they are a dementia care facility, these are what a consumer can expect that this facility actually provides. Like I said, we are in a monitor position. There is no state fiscal note on this. This has passed the House and is scheduled for its first hearing in the Senate on Wednesday. And then House Bill 1110, this is vulnerable adult financial exploitation banking. So this would allow a bank employee, if they feel that a vulnerable adult is coming and is like, I need to transfer $50,000 to this bank account right now. And if they seem to be flustered, if they seem to be agitated, if they seem, just something that says something is not right, that this bank employee could hold that transaction. You see this a lot with, quite honestly, with like at grocery stores with, clerks, because a lot of times this kind of follows this theme of gift cards. And so a clerk might see like, oh my gosh, this person, something's not right. And a grocery store clerk will kind of stop the transaction just so they don't spend this like, hey, you're getting scammed. Bank employees are a little bit different because if you are the account owner and going in that I want to transfer this money, right now they really kind of have to obligate that. And there's not an opportunity for them to say, wait a second, this doesn't seem right. You're transferring 50,000, you're clearing out your checking account and it's going to an overseas account. Let's take a moment and let's hold this account. This one got interesting just because of the liability protections that banks were looking for, and they kind of got hung up on that part, not so much the exploitation part. But it did ultimately pass the House and it is waiting its first Senate committee assignment. PPACG is supporting this bill, and there is no state fiscal note attached. And so those are the 5 big bills I kind of wanted to bring for awareness. I'm not going to pause for questions right now because I want to make sure we cover the state budget process, which is it's in short, it's a mess. Just to be completely blunt. Yeah. And so if you saw numbers last week about a $1.5 billion shortfall, that was in relation to the last quarterly budget revenue forecast that came out on Thursday that had the state budget shortfall for next year going from $850 million to $1.47 billion. So a nearly doubling of what was forecasted in the December forecast. But that's why state fiscal notes are going to be so important this year, because really anything with a fiscal note even like the one bill I mentioned that has a $10,000 fiscal note. I mean, they were looking under the couch cushions last year. And so they're really trying to kind of figure out basically how to address a $1.5 billion shortfall. Again, last year was about 1.2. Year before that was about another 1.2. And so that is up to the Joint Budget Committee. They are scheduled to introduce the budget on Monday. You might also hear it referred to as the long bill, but those are the same. Those are one and the same. But it could be delayed. It was delayed last year, but by a week. And so, you know, it's like the reason this long bill last year's bill came in at 415 pages. So that's scheduled to come out. If it comes out on Monday, it'll be introduced in the House this year. It'll take about a week to go through the House, and then it'll go to the Senate. It'll take another week to go through the Senate. And then so if you're looking at mid-April of when the long bill will be adopted, that gives us about a month left in the session for any bills that are stuck at the appropriations committees to go through the appropriations committee, to go through that chamber, and then to go over to the second committee, go over to the second chamber. Part of that $1.5 billion figure is including funding the senior homestead tax exemption, which is about $250 million part of that puzzle. The fact that they're including that in there and it's not already out, believe it or not, it is a good sign, and that it's in and not, it's on the inside and it has to get pulled versus on the outside it has to get put back in. The legislature does not want to cut the senior homestead tax exemption, and I think that's why it's being included in the shortfall estimation. At the same time, that is $250 million in a $1.5 billion budget shortfall that could be up for consideration. But we are hearing a couple different options if they decide to deal with that. And again, they really don't want to, but if they do, we're kind of hearing a couple different options of what that might take to look like. They might fund it at a portion, so say 70%, 80% of what that is. So that's one option that I've heard a little bit about. That at least helps kind of save a little bit here and there. The other option I've also heard is that if they decide to cut it, will they take some of that money that is saved and put it into the state fund for senior services? Why that is important for us is that that is our state source of funding at for our agency, which then we provide to providers. That would not, the numbers I'm hearing would not be a 1-for-1 transfer. Literally pennies on the dollar. So the number I keep hearing, if they decide to go like that, again, this is a big if, but just want to provide planning and awareness. So if they were to zero out to senior homestead tax exemption, again, that's about a $250 million budget amount. The number I'm hearing is that about 8 million would go into the state fund for senior services. That is just over a 50% increase in the state fund for senior services across the state. The idea with doing it that way is that, you know, local area agencies on aging, we are closest to those who might be experiencing some hardship because of the senior homestead tax exemption, and that we would be in a better position to be able to kind of really address those in the greatest amount of need from that exemption going away. Like I said, there's a lot of ifs involved if we get to that point, but I just want to make you aware that if that happens, that's kind of one of the ways it's looking at. But again, 8 million off of 250 million is about a 3.6%. And like I said, pennies on the dollar. But it is at least something, and they're recognizing that there is a huge need, that the last time this happened, it really did impact seniors in a dramatic way. And so that's partly why they don't want to go down this road again. But if they do, can they find a way to at least soften that blow at least a little bit? So that's kind of the budget picture. Once the long bill is introduced, you're likely to see what's called orbital bills be introduced along with it. Last year we had 63 orbital bills, and what these bills are is that if there's a change in statute, so for example, that state statute requires X amount of money to go into these certain funds. If that statute needs to change, that's where these orbital bills will come into play. And so those are important to track as well. So once these bills come out, we're going to see about 65 probably bills drop at the same time, which means someone like me gets to go through and see what the impacts are. So like I said, we're expecting about a month from when the long bill or the budget is passed to the end of the session. So we're expecting a very busy last 30 days of the state session. That's what I've got. I'm happy to answer questions to the best of my ability. I see. Yeah.
Debbie. Debbie,
Go ahead.
Debbie.
So you've mostly talked about possible cuts. Are there tax increases? What have you heard in that regard?
So obviously with Tabor, the ability for the state to increase taxes is incredibly limited. And so there are some mechanisms. There is one particular bill but it would largely be funding a lot of like tax credits through kind of the Tabor refund process. But it would do that. It would raise revenue. Like I said, it is really difficult for the state to raise revenue through the taxpayer bill of rights process. And so like it's interesting, there's one bill in particular that is expecting to raise $89 million, but that's also going to be funding a lot of these tax credits. So it's interesting how that will play out. But yeah, no, I would, you aren't going to be able to see tax increases. I know there is a state ballot initiative that is trying to get on. I think they've cleared the title process and they're in the petition gathering phase, which would change and move Colorado to, I think, what's called a graduated income tax system. And that would kind of be the first attempt to try to raise taxes in some way and increase state revenues. The earliest that's going to happen is this November. And it would have to pass, and then that creates other steps down the process. We had very limited options for the legislature to do anything in terms of raising revenue.
Thank you.
But I did.
There you go.
There you go.
There you go. Thank you. I would add following this in a couple of different venues, and I always appreciate your research and sending the information out to us to cross-check all that. But they can't raise our taxes, but and in my judgment, our legislature doesn't have a revenue problem. They have a spending problem. And a big part of the problem was during the ARPA funds. I heard a really great analogy. It was like you got a $2,000 check from your ARPA. So you thought, well, I'm going to go buy a car because that'll cover my first 3 payments. Well, now what? So the legislature created programs that have ongoing charges. Well, they don't have the money, nor did they anticipate where they were going to get the money from that. And also, correct me if I'm wrong, but I believe the governor in his budget, he didn't even present a balanced budget in the beginning. So it's just, they've got a real problem. And personally, when you talk about Tabor, the whole issue of tax credits, they're chewing up Tabor refunds, whether that, and I will, in full disclosure, I was mayor pro tem when Tabor passed. I didn't like it then, but not for the reasons that it exists today. That's another discussion, but it's there, and it's rather disingenuous the way they're eating up Tabor through tax credits, which is what you referenced. I'm just being a little more blunt about it, Jared, is all. And so I think it has great reason for concern. I'm glad to hear that the homestead exemption is at least something they'd like to continue. Certainly that's a real important thing for a lot of folks. So, but from an inside track, it's complicated, and it will be interesting to see what they do with the long bill when it drops next week. So thank you for that update. I appreciate it.
You're very well. And you kind of mentioned there's a difference between taxes and fees. And so you have seen the legislature really increase fees as a way to kind of increase revenue. There's a right, no, and like you said, fees aren't taxes. And so you've really seen that as a way to kind of to build the revenue. I will say, kind of going off of what you said, right now they haven't, and every other local and county government, primarily locals, you've seen this a lot. Colorado Springs was in a position. Monument, I'm seeing Councilmember Laura Ronick shake her head up and down. Denver did this last year. Like they're doing flat out layoffs of staff. The state has not had that discussion yet. They and I agree they should. The reality being that usually personnel is always going to be your biggest expense. You never want to see anybody laid off. But I mean, Colorado Springs is doing furlough days. Denver too. Yeah, no. So it'd be interesting to see what the long bill comes out with. I do know, just listening to the Joint Budget Committee, they are really looking at staff lines. At least, you know, if you're increasing FTE full-time equivalencies, you have to have a really good reason, and they're really looking at, I would say, much more into weeds than I would have expected of individual positions and whether they need to be funded. And so, yeah, I wouldn't want to be a Joint Budget Committee member right now.
Eh? Yes, so I'm listening to a couple of different threads here. So when I think of a $1.5 billion deficit, I'm thinking we're bringing in 1.5 billion less in tax dollars than we did last year? Or do I go with your theory that we set up unfunded programs? Is that what's going on?
There's a whole, yeah, it's a little bit of everything. And so this Joint Budget Committee receives budget forecasts from two different offices. One is the Governor's Office of State Planning and Budget. The other is Legislative Committee. So you got the Executive Branch and Legislative Branch both doing budget projections. And a lot of times they go over what's called two scenarios. And so scenario A is typically like, hey, no changes. Here's, if you're going to do it, here's what next year's budget will look like. They don't usually look at that, and that wasn't where the 1.5 came from. Scenario B is looking at, hey, based on what other state statutes are requiring to spend in future out years, based on what have already been decided, or at least been proposed and adopted by the Joint Budget Committee. And then we also have to fill in for this upcoming year. So we had to dip into reserves this past year. And so to get the state back up to a 15% reserve fund, each percentage point is roughly $100 million, but the state is supposed to be at 15%. So to get back up to that, that's about it's about 400 million just to fill into reserve to where the statutory requirement is. But yeah, no, there's a lot of things. They did produce a lot of programs. State FTE has gone up by, we got the numbers, but I don't want to quote them in public but it is significant. The number of FTEs, the number of employees at the state have gone up significantly in the last 5 or 6 years. And so no, there's a little bit of everything in terms of how we get to 1.5 billion. You notice I did not say the word pinnacle. I will say it now. And so when the governor did propose his budget last fall, it included a sale of Pinnacle Assurance. That is the insurer of last resort for workman's comp claims in Colorado. That the governor's office expected, if we were to sell it, that'd be about a $400 million, basically generate $400 million for the state. That'd be a one-time budget increase or a revenue inflow. There is a lot of concern about doing that because it is these insurer of last resort in the state. Pinnacle's argument is that, well, because of how it's structured, it can't provide workman's comp insurance for anybody who has a multi-state corporation, or they can't insure anybody outside of Colorado. And that's been a lot of Pinnacle's argument of why they should privatize. the concern about doing that is like if the state has no more say in how Pinnacle is run, will Pinnacle remain that insurer of last resort? And so that's one of those things of, that's an option. There are a couple state ballot initiatives because everyone's seeing that there's this $400 million piggy bank there to fund their own private projects. And so that has not come up a lot from the Joint Budget Committee. At this point, I wouldn't expect it to, but that is something, I mean, if you want to, you can get $650 million between senior homestead tax exemption and sale of Pinnacle Assurance. That gets you quite a ways there. That still unfortunately leaves you about $850 million in the hole, which is where they were before the budget forecast. Like I said, I don't think the state is interested in either of those two options, though, as a way to balance the budget.
Well, the thing that I find most disturbing about this whole conversation is how the state somehow sets themselves up as the expert on a lot of the budgetary issues, and they push it down to the local level. And then when the local level, personal experience, it responds the way the state should, and all of these mandates are unfunded, we're the ones that suffer, but it doesn't somehow work its way up, even though we're the ones that elect the people that are a living problem, and they're supposed to be sitting there representing us. It's all a mess.
So
Yes.
I just want to talk about the senior homestead exemption. So I need to make sure everybody who's listening online and here kind of understands it in grassroots manner. I get the senior homestead exemption, which is 50% off the first $200,000 of your home. My bill has been reduced approximately $500 every year since I've had it. If that exemption goes away, I'm going to have to find additional $500 a year to pay on my taxes. For me, I can do that. There are many, many seniors out there who, are living on fixed incomes that just don't have that $500 to give up. So it is a real and legitimate impact to seniors who are living on a tight budget. I just want to make sure we're all aware of that. Thank you.
Melissa.
The conversation may be coming to a close, but I'm not sure. But in light of maybe it coming to a close, I do want to share a resource that Andy has forwarded to our organization. The city of Colorado Springs has been talking about, wanting to have more, disagreeing better conversations. And so they have kind of put together this opportunity to have civility in the city. And so I have a flyer here. This is an event that's happening on Monday evening at UCCS. It does cost $10 to go. So there are more of these conversations, kind of happening in the, upcoming weeks. But if anyone is interested and wants to kind of explore this and check it out and see how some of the city leaders in Colorado Springs are wanting to kind of foster opportunities for people to kind of disagree better, discuss better. I have this handout here. It is a little challenging to figure out how to, from the handout at least, so I might end up just forwarding people the email itself, because then you can just click and sign up, and it's a lot easier that way. But I do want to get this in people's hands and in front of folks so that people know that it's a resource that is evolving here in our region.
Perfect, thank you. Let's quickly move through our subcommittee. I'm assuming you're done, Jared.
I am, yes.
Thank you.
I was telling Chair Chronic on Monday, I think, Mike, luckily I have no more hair to pull out.
Okay. Membership Subcommittee Chair is,
That's Dawn, and Dawn is not here with us.
okay,
Scotty is on with us. And of course, what we really need to be doing is trying to set up our membership orientation with Scotty and Lakita. Lakita at Department of Human Services did reach out to me today. They are very shorthanded over at Department of Human Services. She is back at work. Some of you know that she had a personal health issue as well, but she is back at work, communicating with me regularly, but could not make it today. But hopefully Dawn and Scotty and I will be having an orientation soon. So that's that update.
okay, thank you. SRS,
And I'm gonna possibly leave this. Jen's not with us either today. So we do have, somewhat of an update. It was included in the packet, so people can look that over. The biggest thing with the SRS is that we're going to be doing the 4-year plan. So, and for those who are on the strategic review subcommittee, I will be working with Jen to pull together a group to meet for that. I just put together the calendar of us doing outreach for the 4-year plan, and this is news to anybody on the strategic review subcommittee because I haven't updated you guys yet, as well as staff who are in the room. My goal will be to have 6 community meetings starting as soon as June. And we will be looking for someone to actually be the kind of moderator for those. The last time we did this, it was B, and it's hard to imagine B not doing it again. But
I just
maybe. We'll see.
I think B would be a great candidate.
We'll
Thank you.
see. And I did think about, other people, possibly Gordon, possibly Clark, doing it in their areas. But I also know it's kind of easier just to be the moderator and be the moderator the whole time than somebody jumping in. But there's a possibility that, possibly, and Laura, I guess you were on my mind too, people could team up with B. B could be the main moderator, and then Clark can team up with B up in Teller County. Gordon could team up in Fountain. Penny Everest can team up, so we'll just kind of see. Just a work in progress. My biggest concern is going to be getting people to come to the meetings. Last year, or the last 4-year plan, we had a lot of planning meeting, community meetings, partly because the age-friendly group was doing age-friendly work at exactly the same time. They had a separate group of meetings. We teamed up. It turned out to be over 60 meetings. And we didn't always have a lot of older adults at those meetings. We had a lot of agency people there. So my focus this year is going to be really to get, I want 120 older adults attending these meetings. How about that, B? Over the course of the meetings. And so I have some ideas and thoughts about it. So I'll be sharing that with the strategic review subcommittee. Also, I think Lori's still in the room. I wanted to talk with our ombudsman about potentially having 2 meetings at a long-term care community with a residents council, maybe. So again, this is brand new. Nobody's heard this until just now, but that is going to be the strategic review subcommittee's work starting immediately. And so that's the update there. And hopefully I'll remember to kind of write that down.
Well, thank you for cleaning up the form.
Yeah.
Looks good. Okay, TRS, B, sorry, Debbie.
I don't think
Right. Right, agreed.
And then I'd like to, oh, go ahead, Gordon. Sorry.
Sorry.
At the TRS meeting, we talked about the process for how a entity receives funds. Staff does an audit, and it was revealed that we don't automatically, or after the audit is completed, we don't provide the results of that audit to the agency unless they ask it. I think we need to come forward with a recommendation to say, if we're going to audit somebody, we need to provide them with the results. in a reasonable amount of time. I don't know what reasonable is, but I don't want to say 2 weeks. I don't want to say 30 days, just a reasonable time. Is that something that we as the RAC would work on, or is that something the Area Agency on Aging works on, or was that something the PPACG Executive Committee works on? I don't know, so I'm asking the question, what do we need to do to go forward to change this?
So I'll comment first on that, I think, and if Carol wants to add some things. I think that that is a recommendation that as the RAC, you guys could definitely bring to us. And I think that our Area Agency on Aging, leadership definitely needs to look at and do. That's my opinion. I think that there are times that the RAC is going to bring things up that Area Agency on Aging leadership might say, well, we like that idea, but we're probably not going to implement it. But the RAC should do more of that. For me, being in this role for 7 years, I'm really grateful to have some of these recommendations be coming up. And I think that they're good to be considered. I'm not always sure that the audit recommendations are not given to our agencies. I think that there is a process when the audit is done that it goes back to our agencies. I'm just thinking that the nuance here might be that it was actually, and correct me if I'm wrong, Carol, too, from what you kind of know and understand too, but I think what did not get back to the agencies was the kind of recommendations and the scoring of what we did within the technical review subcommittee. I think that's where some of the gap happened. But I could be wrong because I know that didn't get back to our partner agencies, as part of the technical review subcommittee process. We don't go back and say, oh, here's what you scored as part of the technical review subcommittee. So that did not go back. But what I do think happens, it just might not happen on a timely fashion or as effective and efficient, is when both our program people within the Area Agency on Aging go out and visit with our partner agencies and come up with concerns, and then our finance office who does their financial audit. But those things do get back to the partner agencies, but sometimes it's just not always, there isn't always good follow through sometimes on making sure that if a error was found, are things fixed? That's the process that needs to be tightened up. What do you think about what I've said, Gordon?
Well, I'm on the part about the technical review subcommittee recommendations. Yeah, I can see it both ways. But I will tell you, speaking to the Fountain Valley Senior Center board president, she said she never got those results. Now, whether we gave it to their director and the director didn't pass it, or we didn't give it at all, I don't know. I don't want to get into a who shot John kind of situation. I'm not here to assign blame. It's in the past, it's the past. We can't go back and change it, but going forward, I think we need to provide it to both the director and the board, so that they can improve. I used to work for a company that said feedback is the breakfast of champions. If you don't know what you're doing wrong, you can't fix it. You can't get better if you don't know where the problems are. A board, any board, doesn't always see how the sausage is made and how the individual decisions get done and what's good and what's bad. So I would make that recommendation, and I would ask that we as the RAC second that recommendation to the Area Agency on Aging, if that's the appropriate agency to make it to.
So maybe we could set up a TRS meeting in the future where we can ask some questions of staff about that, make some recommendations to staff, and then it could be brought to a RAC meeting in the future, and it can be put on the RAC agenda. The other thing I want to comment is that I think we need more people on the TRS. I mean, we only had 3 people at that meeting. I think we had 5 initially, but I don't think, I'm not sure if 2 of those people aren't on the rack any longer.
Well, actually, I think both Lakita and Scotty wanted to be on the technical review subcommittee, but they were so new to the process. And we ended up having a TRS meeting and they still hadn't actually been approved by the PPCG board yet. So we were close, but not close
Maybe
enough.
we could find that out and get a better membership for our next meeting, which we can put off, you know, a couple of months, and we can have the area agency staff bring something to us about how that works, and we can sit around and come up with some recommendations for the RAC.
Kathy has her hand up. Kathy, go ahead. She's muted. There you go.
Yeah, I
Kathy?
just wanted to second that comment. I saw that information in the communication materials about the scoring process, and I would be, you know, less interested in the score as understanding where were the areas that you need to improve. Because if we're, you know, being held to certain standards and we're not meeting standards in certain areas, I think that is really important to communicate to the agencies. So I echo that strongly, and I think it would be important. How can you improve where you are if you don't know where you fell down?
Agreed. Thank you. I guess I'm a process junkie. So I'm having a little difficulty understanding what exactly the process is today that failed. And apparently, it sounds to me like it might be a good idea to start from scratch in terms of, let's pretend we don't know anything. Let's pretend that we get to generate the process from the ground up, starting with the TRS, starting with how this should work as opposed to how it's not working, and just come together and put something together in a document that we can present and then have a discussion about it. And I don't know if it goes bottom up or top down. It doesn't really matter. To me, it matters that it gets done rather than how it gets done or who's in charge, kind of thing. Yes, Carol.
Well, my comment is probably should have been maybe for your comment, but I just wanted to give a little bit of history of how we got here. And that is the goal of funding is to keep all of our providers whole. But we also had to look that we knew that we had a couple of providers that were not meeting standards, but year after year after year, we were allowing them to continue. And year after year, we knew that there had to be changes made. Now, I will say the error that PPACG made and that we take responsibility for, it was lack of communication. And that's why we need to improve upon that. But I do believe, I'm a firm believer that the procedure that we had in place was a good one, because our providers have to take responsibility. And as the funding agent, we have to ensure that our funds are being used wisely. So in the midst of the process, we did lose, you know, a pretty big person who was responsible for this process, and that did not help, right? So I don't want y'all to walk away from here today thinking that the process wasn't a good one. It needs mending, and I feel like we've all learned from that. And I'm asking that you allow us to continue with the process with the little tweaks, with reaching out to the providers, you know, more effectively than we did this year. But I'm a true believer in the process, and we've learned from our mistakes.
Is there a way that the people that are involved in all of this could get a copy of what that process is so that they could understand it?
Absolutely.
we.
Yeah, so to part of, I'm new to this, right? I really haven't been a part of the process, so this has all been new to me. And I've created basically a big summary of the way the process should look. And I'm happy that, you know, the team can get together and we can talk about it and tweak what needs to be fixed. And then, you know, Melissa, being the representative of this committee, can bring it to you.
Perfect.
So maybe a further presentation or a more in-depth presentation to the RAC would be helpful.
And what I'm seeing as the administrator here and what I'm hearing is that I think I'm going to take stuff that I know already from what we've done and get the TRS back together for one meeting and kind of review that, plug in the additional pieces here of, you know, kind of the follow-up with board chairs and, you know, kind of reciprocal communication, and then possibly that we can then bring to the RAC at that point in time. So I'm probably looking at maybe about a 4-month time frame to get that all done, if that's okay with people.
That makes
Okay.
sense. Yes, Carol.
And this isn't a simple process, because in addition to providers and the way providers treat their programs, and there's funding issues. And so we only have so much funding in certain parts. And so part of this is, do y'all really want, I mean, I don't know if you really should be a part of that process. We can give you the information. That's really what our expertise is. So yes, I believe that we should give y'all all the information possible, but just know it's not going to be 100% clear, because there is that kind of behind the scenes funding piece that we have to deal with to ensure that we're doing what we have to for the state compliance.
Well, unless I'm misunderstanding what Gordon just brought forward, I think that we're not interested in getting into the weeds. I don't want to do your job. I promise you. I don't think any of us do. But to have an overview of how it flows, you know, I'm again, process person, flow charts, data, that kind of stuff, just at a high level, no weeds. Okay.
And I think the TRS has gotten that information in the past. Would you agree, B? That we know where I mean, there are some programs that are getting funded at a much less, and some programs, and that depends on legislation in some cases.
Okay. There is no, unless Melissa has something to.
Just one quick thing.
Okay.
Just to make speaking of kind of getting feedback on organizations and how they're doing, we're in the process right now. If Melody was here, she'd be talking about it, of sending out the annual surveys to all the organizations. And we are looking for, if any RAC volunteers want to get a little bit more involved in that process, to help us send out over 5,800 surveys go out to our partner, to the older adults who receive services, and then they fill those out and send them back, and we have to plug that information into a database. And so if any folks want to get involved in that, that would be great. That's number one. The second announcement I have too there is that we are hosting a volunteer appreciation. April is time to appreciate volunteers. Dolly is spearheading that on April 17th here in the conference room. And so I have an invite for all of you RAC members to come to that as well. So I think that would be kind of a little bit of the Jody update.
Perfect. And is there a way we can send him a card or something?
Sure. Yep. So if
Okay.
you want to stick around, I'll get everybody to sign before you guys run out. I'll go grab a card real quick.
Thank you. I think we've done the legislative update and then some. Yes. Okay. Thank you. Chair report. The only report that I have is to thank everybody that does so much of what they do. Carol, first time meeting you. Thank you very much for all the information. Jared, I don't know how to thank you. Melissa, I don't know how to thank you either. There are so many people in the organization that are just doing top-notch stuff, and it's encouraging to see it, to hear it, and to live it. And I want to thank you all. That's all I have. So because of that, w- does anyone else on the rack have any other comments? Hearing none?
Oh, sorry.
Yep.
I just want to share, I have some handouts here for people, and I think they're really, really important to please share with other older adults in the community, other people you know. Of course, I mentioned about the Civility in the City, the volunteer event happening. We have the Silver Key Senior Summit. AAA and ENT is partnering up in April for a Protect Yourself from Scams here at our organization. We have the senior games coming up here in our community in the beginning of June. Right now, people can sign up to be athletes. So anyone you know that's somewhat, doing something great, have them explore the Colorado Senior Games. That's happening. Also in April, the PBS station has Allies for Aging here at the Colorado Springs Senior Center. In April, they're hosting a kind of a caregiving documentary and panel. We are on it. And we are there. So anyway, please peruse my handouts over here and take some things. And please think about 2 people you know that you could encourage to attend one or all of these events. Okay,
Perfect.
thank you.
Thank you, Melissa. Okay, given that, I'm going to adjourn this meeting straight up at noon.
Okay.
Thank you all for participating. Good job. No, I'm not doing her job. No, yeah, like for sure. Yeah, you're right on.
Oh, but here, I'm gonna give it.
Down here.